Hi everyone! Today is a new video all about pre-surgery tips, how to prepare for laparoscopic surgery, possibly you're having a diagnostic surgery, maybe you're going in for your third or fourth treatment to have it removed. Whatever it might be, hopefully this video will give you some really helpful tips and tricks and a list of things to buy ready to prepare for your surgery. Okay, so the first thing I'm going to talk about is a couple of tips for preparing for your surgery. So this is just obviously things that I found really helpful. I would like to state, of course, I am not a doctor or a medical professional, but these are just things from my experience that I found really helpful. So I've had two laparoscopic surgeries. One I had about 2.5 years ago, 2017 I think it was, and the second I had last year, which is 2019 in April. Now the first one, they said they found nothing, so I was under for about 25 minutes I think. They didn't really do much, clearly not enough looking either. So really it should have been quite an easy recovery, but actually I found it harder to recover from that one. So when I went in for my second one, I thought I'd try a few different things. Obviously I thought that this one, and I knew this one would probably be a bit longer, as it was more of a treatment based one. So what I did to prepare is I actually tried to up my exercise. This is really difficult, I totally understand. I was, from January to my operation in April, I was really struggling. My organs had started to fuse together with the endometriosis, so it was getting really, really difficult to even do daily tasks, let alone go to the gym. But something I would say that I absolutely maintain really helped my recovery and prepare for surgery and anaesthetic was walking. So I've got a dog, and I would go on dog walks. I would have to stop quite a few times, but I just found keeping that level of fitness up, getting my steps in, getting some fresh air, really mentally and physically prepared me for surgery the second time round, which is something I didn't do the first time round. I understand if it's not possible for you, but something I would definitely recommend if you can is just a nice light stroll. It will help you mentally and physically prepare. So the second thing, it might seem really obvious, but drinking loads of water. So drinking loads of water is really good pre and post-op, which I'll explain in my next video. But make sure you're keeping up your hydration, drinking water. That will just really, really help. Okay, so the next one might seem really obvious, but you need to pick somebody or a couple of people that are going to be your support system. So preparing for surgery mentally and physically can be really, really difficult. You need to make sure that you've got that chosen person that's going to either stay with you on the day of the surgery, if it's a private one, if you've got a private side room or something like that, then they can wait there, or somebody that can drop you off and pick you up and very much be there and be a support system for you. Obviously, some people have work schedules that are a bit tricky to get out of, so you need to try and prepare that ahead of time and say, look, this is going to be the date of my surgery. Are you around the day of and day after to look after me, especially if you're living on your own? It's really important that you have somebody for 24 hours after you've had an anaesthetic that can stay with you. Even if you're sleeping, it's just really important to have that person. This last one, just in terms of prepping, this should come with all your pre-op. You'll get a pre-op appointment before you have your operation. It's usually, I think, about 2 weeks before, where they'll take some bloods, they'll run through a checklist of things that you need to do before surgery. Everyone's different. You might be having a certain diet to follow before surgery. Some people do, some people don't. But it's just really important. They give you all of it on the form, so don't worry if you're overwhelmed in the appointment. It's all there and they're brilliant. You can phone up and ask questions. But something to really be aware of, and this is something that I kind of forgot during one of my surgeries, is write a list of all your medications that you take, because you'll be surprised that there may be some that interact with the anaesthetic or they just don't like you taking before an operation. So be really clear in stating in the pre-op what you take, because it could be that you may need to stop taking it 2 days before or something like that. So just remember that one. Now to the fun bit. So shopping is my favourite thing to do. So as you can imagine, in lockdown, I'm struggling. I don't do online shopping. I like to feel the product. So I am really struggling at the moment. But shopping for your surgery isn't exactly exciting, but I like to turn a positive twist onto it, and it's an excuse to buy some new things. The obvious choices are obviously slippers and a dressing gown. So I like to use this opportunity to treat myself to a new pair of slippers that my dog hasn't chewed, and a new dressing gown. I find it's just nicer if you're going into a hospital environment, especially if you're going under an operation, to have fresh new stuff. So that's something I do. Now, Primark is my go-to. Girls everywhere. Primark is amazing. I love Primark. It's cheap, it's cheerful, it can be great quality as well, but it's perfect for something like this, because if you get blood, if you get anything, food, anything on your dressing gown, your pyjamas, anything like that, it doesn't matter. It's usually about £7 anyway, so you can kind of take a view on it. As long as it's comfy, and Primark do an amazing range of pyjamas, sleepwear, all that kind of stuff. So I would definitely recommend doing that. I go straight down to Primark. I also go and get some big pyjama bottoms and trackies. So I usually go 2 sizes up. I make them so stretchy that you can fit another one of me in there. I don't want anything constricting. So after surgery, and even before really, you don't want anything pressing on that tummy. So you want to make sure that it's really nice and baggy. I'm somebody that doesn't really do nighties. I don't really do them. I get quite cold, so I like to wear lots of layers. So that's a way of doing it where you're not going to feel any tightness. So I definitely recommend that too. Dry shampoo. I swear by this stuff anyway. It is perfect though for if you're having a surgery or if you're not going to be able to wash your hair for a couple of days. I can get away with at least a week with this dry shampoo. Obviously other brands are available, but I would definitely recommend grabbing a can of this before you're going into your surgery. Wash your hair the morning of. Do a lovely nice hair mask if you can as well. Pop your hair up, and then you probably want to avoid washing your hair, lifting your arms up, doing all that kind of stuff for a good 5-6 days. So this will last you really well. The next one we've got is a body scrub. I don't know if you can see that. This is just my favourite one. I love this range. Now the reason I say a body scrub is because I wear fake tan religiously. When you go into the operating theatre, you shouldn't really be wearing any fake tan. So you need to take all your nail varnish off, all your fake tan off. Sad, it's very sad. All your makeup off, everything. You're going to be as bare and as natural as you can be. So this is fantastic for scrubbing off those last bits of fake tan. It's also a brilliant way to exfoliate your skin and prep. So after surgery, you may get quite dehydrated. So it's a really good way to keep on top of that. I just love body scrubs. I use them like 3 times a week, which is probably too often. But yeah, I swear by this. Might seem obvious, but a razor. Now this one you've got to be a bit careful of, and I was trying to find my pre-op notes actually to see what the deal was with it. But from what I can remember, and please don't hold me to this, I don't think you are meant to shave the area that they're going to come in contact with at least 2 days before. I think they deal with that for you, which is great. Like, it's like a mini salon in there. So what I would say though is legs. So they're not going to be touching your legs, but they're going to be seeing your legs. Now, some people do not care at this stage. You've probably had so many internals and so many doctors looking at your body, you probably do not give a crap what your legs look like. But it's more for me personally, the fact that I'm not going to be able to shave my legs for 2 weeks. Night before, you have a lovely warm bath, shave those legs, get it out of the way. Hopefully it will last you a week, if you're lucky. And then it's just one less thing to think about. So, razor. The next thing to pop on that shopping list is bio oil. A lot of you have probably heard of bio oil. It says on here, I'll actually read it out. So it's specialist skincare for scars, stretch marks, uneven skin tone, aging skin and dehydrated skin. So I swear by this stuff. I've had quite a few little procedures done, skin mole removals and things like that. And I swear by this stuff, it's amazing. You wouldn't even know that I've got a scar in certain places. So it is amazing. What I do say is start using it before your surgery as well if you can. So what I do is I had a small mole removed from my foot a couple of years ago now, and I started using it on my foot before the surgery, and I swear, I don't know if this is an old wives' tale, but I'm telling you now, it worked. The foot one is the one that you can barely see, and it was the worst one. It was very deep, the incision. So I don't know, maybe it's a load of rubbish, but what have you got to lose? So start using it on your tummy before surgery if you can. I just feel like it hydrates the skin, gets the elasticity back. That's a really hard word to say. And yeah, you don't want to use this, it's really important to know, you don't want to use this straight after surgery, absolutely not. You'll still have stitches, the incisions will be far too new to use it straight after surgery. Check with your doctor when you can use this because everyone differs. I think for me, it was about a month later I started using it. And I just popped it on my scars, and my scars look amazing. You wouldn't even know they're there. So the next couple of things, I haven't actually got objects to show you, but really just the obvious ones on a shopping list. So I'm going to read them out to you. So we've done the obvious kind of ones from Boots and Primark. The other thing as well is, of course, pads. So something I would say is 9 times out of 10, I believe that most women do bleed after surgery. I know that I woke up in a very disorientated state with a pad, no underwear on, just with a pad placed between my legs, but with absolutely nothing to hold it in place. So it was a bit strange. So as soon as I got back to my room, I was like, right, I need some underwear and I need to put a proper pad in and feel a bit more secure. Now, what I would say is hospital pads are horrible. They're absolutely horrible. They are massive, but also have no stickiness to them. So just don't even bother with that. Just come prepared. So what I would say is bring a night pad, whatever you want to use, bring a normal daily one, and bring some pant liners as well. I swear by pant liners. Obviously with irregular periods, you don't know when you're going to come on and off. So it's quite good to just wear one daily really. And you don't really feel that they're there if you get the really thin ones. But that's something you'll probably need later on. But yeah, just definitely put them in your hospital bag ready. Plasters and bandages. So they do give you some dressings. So when you come out of surgery, you've usually got 3 incisions. It's different for everyone. You can have 1, 2, 3, 4, however many. I think I had 3 from memory. Now what they do is they just put, it's quite neat actually for me anyway. It was just a neat little kind of plaster with a slight bandage to it. Now I am quite allergic, I'm very allergic actually to latex. So a lot of adhesive and a lot of plasters and things like that contain latex, so it's a bit of a nightmare for me. So I try and preempt this just in case. I mean, most hospitals are latex free anyway, but just in case, it's better to go to a chemist beforehand and just stock up. Another thing as well that I find, and people don't talk about this very often, they send you home with a couple of bandages and a couple of plasters, but if you're wanting to shower, which I know I definitely did, I had a shower straight after my op, the nurses helped me, I wanted to get that iodine off of me, I wanted everything off of me. I felt really gross. And I wanted to shower daily really. Obviously not all of them are waterproof, and even if they say they're waterproof, you don't want those incisions getting wet. So something I use, might sound ridiculous, is cling film. I swear by cling film. So I literally, it's as ridiculous as it sounds, I get my plasters on and I wrap myself in cling film and then I get in the shower and nothing gets in. I swear, nothing gets in. It's amazing. It's my new trick I found from having so many surgeries. So the last thing I'm going to mention on our shopping list to prepare for surgery is a V-shaped pillow. I don't have one, which is crazy. I've got a kind of a long one that I've used, but I am definitely going to invest in one for my next surgery. But loads of my endo friends say it is a saviour. I think you can get them from IKEA in the UK, Dunelm, places like that. They're really cheap as well. They're like a pregnancy pillow, but apparently they're amazing for after surgery. So yeah, I would highly recommend getting one of those and have that on your list. That's the shopping list done. There are a couple more bits that you will need after surgery, but I'm actually going to mention that in my post-op video that's coming up next. So before you panic thinking, why haven't you mentioned peppermint tea, for instance? It is coming up, I promise. I just wanted to make 2 separate videos so they weren't too long. Hopefully that's been really helpful. If I've missed anything out, please pop it on the comments below to help anyone else out. And obviously please do check the comments if you want to see some more ideas. That's everything I could think of for now. But yeah, it changes with each surgery. You learn along the way, you hear tips along the way, and also it's just what works for you. You know, not all of the things I've just mentioned will work for you, and that's absolutely fine. But hopefully this video has been helpful and given you some ideas about surgery. If you are having your surgery, I know at the moment it's a really crazy time with COVID and everything going on, but if you are having your surgery, good luck. You will be fine. It's not as bad as you think it's going to be, if that's helpful at all. I think we all mentally prepare for it to be this awful surgery and it'd be really horrific and painful. in my experience it hasn't been. It's always been a little bit better than I thought it would be, and a bit easier as well, and certainly these tricks that I've spoken about today have helped that. So good luck. My DMs are always open. Please feel free to share this video to anyone that might need it, and yeah, see you very soon. Bye.